Hello, my name is Zinky, and I'm excited to share my practicum experience at the Autistic Foundation of Grenada. This experience has been incredibly rewarding, providing me with a valuable insight into public health, autism advocacy, and the challenges faced by individuals and families living with autism. Throughout my practicum, I had the opportunity to conduct research, develop educational materials, and engage with stakeholders to improve autism awareness in the community. The Autistic Foundation of Grenada is a nonprofit organization dedicated to supporting individuals with autism and their families through education, advocacy, and community engagement. The organization works to increase awareness, reduce stigma, and improving access to resources for individuals on the autism spectrum. One of the main goals of the foundation is to provide accurate and accessible information to parents, educators, and healthcare providers so that children with autism can receive early intervention and appropriate support. This mission resonated deeply with me as I am passionate about preventive healthcare and health education, especially in underserved communities. For my practicum, I worked remotely with the foundation, contributing to several key initiatives, including community assessment, educational material development, and stakeholder engagement. I chose this practicum because I wanted to gain hands on experience in public health, particularly in an area where awareness and early intervention can make a significant difference. Autism is a growing concern worldwide, yet many communities lack the necessary resources and understanding to support individuals on the spectrum effectively. As someone deeply interested in preventive medicine and community health, I saw this as an opportunity to bridge gaps in knowledge and provide meaningful contributions. Additionally, working in an international setting allowed me to develop a broader perspective on public health challenges and solutions. While this experience was rewarding, it also came with the challenges. One of the biggest difficulties was communication, since I worked remotely and across different time zones. Coordinating with the stakeholders and getting feedback in a timely manner was not always easy. For example, one of my main projects involved developing survey questions to assess community awareness and needs related to autism. However, the finalization of these questions was delayed due to the need for a stakeholder meeting, which has been pending since January. This delayed some aspects of my work and made it difficult to move forward with the data collection. Another challenge I faced was adapting health information for different literacy level. Autism awareness varies widely in Grenada, and some people are unfamiliar with the key concepts related to autism diagnosis, early intervention, and available resources. This required me to carefully structure educational materials so that they would be accessible to a broad audience. To address communication strategy challenges, I stayed proactive by regularly following up with my supervisor and other stakeholders. I also adjusted my schedule when necessary to ensure better coordination with the team in Grenada. By being flexible and persistent, I was able to complete most of my deliverables despite delays. For the issue of health literacy, I applied competency in 18, which focuses on selecting appropriate communication strategies for different audiences. One way I did this was by creating an FAQ document that answered common questions about autism in simple, clear language. Despite these challenges, I successfully completed several major deliverables during my practicum. I finished a survey document, frequently asked questions document on autism, educational brochure, stakeholder meeting summary, and a practicum write-up. Each of these deliverables played a role in advancing the foundation's mission and will continue to support autism advocacy in Grenada even after my practicum ends. This practicum has had a significant impact on my professional development and future career aspirations. It reinforced my passion for public health and preventive care, while also helping me build skills in research, health communication, and community engagement. One of the biggest takeaways for me is the importance of tailoring public health interventions to the needs of specific populations. Every community is different, and effective health communication requires an understanding of cultural, social, and economic factors. This experience has prepared me to be a more adaptable and culturally competent healthcare professional. In the future, I plan to integrate what I've learned into my medical career by advocating for better health education, early intervention strategies, and equitable access to care. Whether in primary care or public health, I want to ensure that all individuals, regardless of backgrounds or ability, receive the support they need. Overall, my practicum at the Autistic Foundation of Grenada was an eye-opening and enriching experience. I gained practical skills, navigated real-world challenges, and contributed to meaningful initiatives that will benefit the community. I am grateful for this opportunity and for the guidance I received from the site supervisor. And thanks for listening, and I appreciate the opportunity to share my journey.